Tips for back pain relief. Sleep better for back pain relief. When you have back pain, sleeping can be hard. It can be a vicious cycle because when you don't get enough sleep, your back pain may feel worse. A poor sleep position can also aggravate back pain. Try lying on your side. Place a pillow between your knees to keep your spine in a neutral position and relieve strain on your back. If you need to sleep on your back, slide a pillow under your knees. Be sure to sleep on a comfortably firm mattress. Back pain and your posture. Grandma was right. Slouching is bad for you. And poor posture can make back pain worse, especially if you sit for long periods. Don't slump over your keyboard. Sit upright, with your shoulders relaxed and your body supported against the back of your chair. Try putting a pillow or a rolled towel between your lower back and your seat. Keep your feet flat on the floor. Back pain medication. There are two kinds of over-the-counter pain relievers that frequently help with back pain. Non-steroidal anti-inflammatory drugs, NSAIDs, and acetaminophen. Prescription back pain relievers. Some people may need prescription-strength NSAIDs or opioid medications to help with pain. Antidepressant medications. It is believed that antidepressants' influence on chemical messengers may affect pain signals in the body. See a physical therapist. Physical therapists can teach you how to sit, stand, and move in a way that keeps your spine in proper alignment and alleviates strain on your back. They also can teach you specialized exercises that strengthen the core muscles that support your back. Ice and heat to ease back pain. Regular applications of ice to the painful areas on your back may help reduce pain and inflammation from an injury. After a few days, switch to heat. Apply a heating pad or warm pack to help relax your muscles and increase blood flowing to the affected area. Hands-on therapy for back pain. A recent study found that one weekly massage over a 10-week period improved pain and functioning for people with chronic back pain. Nerve stimulation for back pain. Research is being conducted on certain treatments that stimulate nerves to reduce chronic back pain. Your doctor may consider adding acupuncture to your treatment plan. 6 stretches to help back pain. Knee to chest. Wrap your arms around your thigh near shin, and gently pull the knee towards your chest. Hold for 20 seconds and slowly extend the leg to starting position. Repeat 3 times each leg. Lying knee twist. Hold in a position that allows you to feel a gentle stretch through the back and buttocks muscles for 20 seconds. Tighten your core muscles and rotate back to center. Repeat 3 times on each side. Yoga cat-cow. Start this more by kneeling on all fours with your hands beneath your shoulders and your knees directly below your hips. Exhale and gently arch your spine. Inhale, tighten your core muscles and round your back like a cat. Move slowly between movements and hold in each position for 5 to 10 seconds. Repeat 10 times. The other 2 exercises are as follows. Piriformis seated stretch. Cobra stretch. Disclaimer. This material is presented for informational and educational purposes only. This information does not constitute medical advice and is not intended to be a substitute for professional medical advice. You should always seek the advice of a physician or other qualified healthcare provider before beginning any exercise program. If you experience any pain or difficulty with these exercises, stop and consult your healthcare provider.